Hi, my name's Claire and I am a Pilates instructor and sports massage therapist at Marsh Physiotherapy. I am currently 30 weeks pregnant, so we decided to put together a selection of exercises that can be beneficial for when you are pregnant, if you have or haven't done Pilates before. So enjoy! So this exercise is rib cage closure. We tend to do this lying down in relaxation position. Obviously after 16 weeks it's advised that you don't lie down on your back when you're pregnant. So we're going to do it standing. We start against the wall, so you want your feet to be about 30 centimetres or so away from the wall, and then you're just sending your bottom against the wall. Your feet are in parallel and hip width apart. Your knees, you're just going to bend your knees ever so slightly, so you're just in a slight squat. Not too low, just so you feel comfortable. Then, checking that your pelvis and your spine are in neutral, so you've still got your natural curves in your spine. You're open through the chest and your head is sat on top of your spine. This one's a great one to encourage the relaxation, opening and closing of the rib cage, which as you get bigger, those ribs are going to expand and flare. So it's a great one to open up the rib cage and also encourage deep breathing as well. So you start with the arms by your side. You're going to inhale to bring both arms up in line with the shoulders, palms facing each other. As you exhale, you're going to send both arms up towards the ceiling, and you're thinking about softening and closing the rib cage. You're then going to inhale to bring the arms back in front of you, and then exhale to lower. So inhale, shoulder height, shoulder width. Exhale, soften and close the rib cage. Inhale to come back in front of you, and then exhale to lower back down. So you're working all the way through the chest muscles, encouraging that breathing. Softening the rib cage as you bring the arms up. Exhale to bring them down, all the way back down. And you're still maintaining that natural spine as well, so the spine and the pelvis aren't moving, it's all coming from the shoulders. So this exercise, we're standing. You want to make sure that your feet are in parallel and hip width apart, nice and tall through the spine. Pelvis is in neutral, open through the collarbones, and long and lengthen through the head. You can use a chair just to give you a little bit of support, because sometimes in pregnancy balance can be a bit of an issue. So this one, walking on the spot, is a great one to build up the circulation again in the lower legs, help prevent swelling, and also it helps strengthen the feet and the ankles as well. So for this one, you start by lifting one heel up onto the tip of the toe. You then push up so that you're up onto both tips of the toes. Lower the first heel down, and then the second. And then repeat on the other side. So lifting the heel, pushing up through both feet onto the tiptoes, lower the first heel down, and then the second. Again, you can repeat this sort of 8 times each time. So one of the other symptoms of pregnancy is lower leg cramp. So one of the ways to help prevent this is just a simple calf stretch. So again, you can use a chair in front of you, or you can stand against a wall. You just take one foot behind you, so you take a step back, both feet are in parallel, bend the front leg, and then just shift the weight slightly forward. You don't want to hold this stretch for more than 20 seconds because we're not aiming to increase the length of the muscle, you just want to maintain the length, so just opening that up. Just take a few breaths and then bring the feet back to parallel and repeat on the other side. Make sure that you've got that nice connection through the abdominals, lifting up out of the spine. Just 20 seconds and then return. We're going to look at some footwork exercises now, which is really important in pregnancy, because as we progress through pregnancy, we put on extra weight, which puts more pressure through the feet. Also, with the release of hormones as well, it can make all those ligaments relax. So it's important to keep the feet strong. Plus you can get swelling through your feet and your ankles as well. So this is a good way to not only strengthen the feet, but also help to move that fluid around. So you start in the seated position, feet are parallel, feet and knees are hip width apart, and you're sat at the edge of the chair, nice and tall through the spine. So with this one, breathing's just normal. It's called the Mexican wave. You keep your foot as flat as you can on the floor, and you're lifting one toe at a time, bit by bit by bit by bit. So all the toes are off of the floor. You're then going to place the toes back on, starting with the little toe, second to little toe, third toe, fourth toe, fifth toe. So each time, as you lift each toe individually and then place them back down, you're thinking about spreading and lengthening the feet as you do so. You can do this 6 times on each side. The next exercise you can do is working the arches. So keeping that ankle and foot as flat as you can. You imagine that someone is pulling from a piece of string and just lifting your arch of your foot. You're trying to keep the toes long and connected to the floor, and then you're just lowering the foot back down. So this is great if you're slightly weak in your arch, because it's really working and strengthening the foot. And again, just do this sort of a couple of times on both feet. Beware of any cramping. So continuing on with our foot exercises, and to help any swelling that you are getting into your ankles and your feet, you can do a simple exercise which is called ankle circles. So you're just going to lift your knees slightly so your foot is off the ground, and then just support underneath the knee by clasping the fingers. Then you're just going to circle the foot 8 times in one direction, and then 8 times in the other direction. Again, breathing's just normal. This is just to loosen up the ankle joints and also help with any swelling as well. And then repeat on the other side 8 times each way. This exercise is called chest expansion. You're sat in a chair for this one, so you want to be sat at the edge of the chair, right up on your sit bones, nice and tall through the spine, open through the chest. Your knees and feet are hip width apart, and you want your feet in parallel. You want your feet directly underneath your knees, so your hips and knees are at 90 degrees. This one's a great one to open up the chest and also to mobilise the cervical spine, so that all those parts in your neck that feel quite stiff. So bring both arms slightly in front of the body, fingertips are face down, palms are facing behind you. You take a nice deep breath in. As you do that, you're going to send both arms back behind you, turning your head from one side through the centre to the opposite side. And then as you exhale, you're going to bring the arms slightly back in front of the body. So you inhale to send the arms down and back, turning the head to the opposite side that you started with, through the centre, to the side, back through the centre, bring the arms forward. So you're going to do this 6 times in total. As you're doing this, you're trying to keep the space between the shoulder blades. You're dropping the shoulders down and lengthening the neck up and away.